Facing a record number of patients over the last few weeks, this Toronto hospital is doing what it can to keep wait times down.
I am in a lot of pain. If you ask me from 0 to 10, I would tell you 15.
But after dealing with a severe headache for 24 hours, this man felt the need to go to the ER.
This way?
Now he's facing a familiar scene playing out across Canada: overcrowding and long delays. The Canadian Medical Association is calling for an overhaul to the system, saying ERs shouldn't be substitutes for walk-in clinics or primary care. We are facing a primary care crisis in this country, and we urgently need to find solutions. They say we need more family doctors to help as the situation grows bleaker.
20 hours, 30 hours, 50 hours. I've seen 100 hours, people waiting to get into hospital on stretchers in hallways.
Hospitals in New Brunswick say they've reached critical overcapacity, while in BC, officials say they hit a record number of patients in hospital, more than 10,400 in just one day. Staffing shortages, surgery backlogs, and an influx of respiratory illness are just some of the additional pressures. There were calls to avoid ERs for non-urgent matters in Quebec, but this doctor says that's not the answer.
At the end of it, the wrong people stay away. And telling them to stay away puts them at great risk.
Some solutions are underway. Manitoba's government announced it will phase in 36 new acute care beds starting in March. In Ontario, the health ministry told hospitals to increase staffing by 20%.
We increased the number of available physicians and nurses in order to meet those demands.
After nearly 4 hours, Gabriel Shimada was relieved to see a doctor, something many others are still waiting for. Tashana Reid, CBC News, Toronto.